Okay, good afternoon. I'm Mark Pilon. I'm the fire chief here in Frisco and the emergency management coordinator for the city. I want to give you an update on kind of where we are this afternoon. As many of you know, we were notified sometime this morning that there was a presumptive patient, and I want to stress presumptive coronavirus COVID-19 patient here in the city of Frisco. I'd also like to mention that this is something that we have been preparing for in the city for the last couple of months, really. EMS directives, screening patients at dispatch, our fire department paramedics, increased level of training, our personal protective equipment. So this is something that we have been prepared for. Our job is prepare for these types of instances. I'd also like to let you know that we deal with infectious patients on a continuum. It's not anything new for our paramedics to transport people that have infectious diseases. This is no different, and they're prepared for that. They have the proper training and personal protective equipment to handle any incident that they may encounter. We've also have a city coronavirus task group that has been formed and meeting on a regular basis in person and conference calls, again to prepare. We want our city prepared. We feel that we're the best prepared city in the country to handle an event like this. So I want you to let you know that it's something that we've been planning for quite some time. We are in close contact with Collin County government and both health departments here in Collin and Denton County on a regular basis. We have daily calls with the State Department of Health and weekly calls with the Center of Disease Control. So again, this preparation has been going on for quite some time. Our team includes Dr. Mark Gamber, who is our public health authority and emergency physician, Medical City Plano Emergency Department. So we feel that we're well prepared and well versed to handle anything that may come our way. So I'll be glad to answer any questions you may have.
Chief, what is the preferred response if someone feels like they have symptoms now that they know that there is a possibility of exposure here in Frisco? Do you want them calling 911 or just staying at home and let someone bring a test kit to them if it's being necessary?
Yeah, I think the best course of action is always call your physician. You call your doctor, explain to him or her what your symptoms are, and let your doctor give you some advice from there. That's a great question in terms of this is flu season. We've been in flu season, so we deal with a lot of patients with flu-like symptoms as well. So we would always advise you to call your doctor and get some advice there.
Can you talk to us about this possible patient or he is a patient? What can you tell us about him? Did he fly to and from California? If so, which airport?
Yeah, we don't have any of that information. We just do know it's a male in his 30s, that the travel was in California from our understanding. I think another thing to know that there's surveillance, and that is the health department is responsible for all the surveillance. So and I was on the phone earlier with Collin Health Department. They are working right now with the patient in terms of contacts, in terms of travel, where they've been, different places they may have been. So they have epidemiologists on staff. That's what they do in tracking surveillance of this type of case. So they'll backtrack all of those contacts in places of travel and notify the appropriate people that need to be notified in terms of may have had contact with the patient.
Chief, can you talk about why the decision was made to keep them home versus a healthcare facility?
Of course, yes. Most of the people from the studies so far that have contracted coronavirus have very mild symptoms, and they do not need hospitalization. And I think that's a great question in terms of we don't want to overrun the hospitals with people that are asymptomatic or B, only have mild symptoms. So I think isolation at home is absolutely the appropriate call. It's my understanding the symptoms are very mild at this time and in most cases will subside. And so no hospitalization is needed.
Does this person have a family? Are y'all watching them? Are they self-quarantined? Are there children in this family?
That's something the health department is working with right now in terms of the presumptive patient and family and any family members in contact. That's something Collin County Health is working with right now.
Can you elaborate on the term presumptive positive? What does that mean versus a suspected case?
Yeah, so evidently there's either some symptomology, it could be the travel. There's some triggers that when you're screening a patient that can trigger certain reactions. In this particular case, I can't speak to exactly what has determined to be presumptive. I would imagine it's some symptoms the patient's presenting, the travel to California. Obviously, the test has to be approved by the health department, and then it goes through the health department to the CDC. So all those tests are coordinated with the state and national officials. So I would imagine that there would be some information forthcoming as to the results of a test that's done through the health department.
Is this a 14-day isolation, and what day is this?
I don't have a number on the day, but it normally is about a 14-day isolation. That's what we've been advised through the CDC and our calls with the state. I don't know what number of day the patient is currently in.
When did they travel? Was that information? You also said that you were notified this morning. So when did you travel?
I don't have the information about when the travel to California was. We don't have that. And I think the point here is, although we're in close contact with the health department, we really try to maintain a lot of confidentiality in terms of protecting the patients. Obviously, the information that we need to protect the public is given, and we work with that information, but some of that information really is held with the health department, and they run that down in their surveillance activities.
Chief, can you talk about have been tested? You don't have results?
We do not. We haven't got any information on any positive or negative results of the test, no. For that.
What's your message to this community? Because I think a lot of the concern is experts just don't seem to know just yet about how contagious this disease is. Whether
Right.
is it contagious like the flu, or is it
Sure.
contagious like the measles, where you can just walk through and breathe the air
Right.
and get it? So what is your message to this community about the level of risk now that it is in this community?
Sure, it's a great question. Right now, it's at the level of what the flu is in terms of contagion. Nothing like the measles. The measles are highly contagious. This is not to that level whatsoever. It's about the same contagious level that you would see in the flu. The message is the community is safe. I think if you look at the mortality rates that we were getting last week from the CDC, we're somewhere around 3.4%. Now they're 1% or less. And I really expect that mortality rate to go down because there's so many cases that are out there that have not been, fully diagnosed, and people have had the symptoms and they've subsided. They thought they had a minor cold, and some have no symptoms at all. So as the incident of cases go up, the mortality rates are really going to go down because it's not what we thought it was at first.
And given that this man looks like in his 30s, I mean, that seems to be the good news. Isn't it probably more dangerous for older folks?
Yes, no question about it. Where we see the mortality rates are in any adults in their mid-70s and higher that have comorbidities. Those are the groups that tend to have the higher mortality rates. The good news is children and ages in 30 and even up until the 40s and 50s have very low mortality rates. It is really the elderly and people with comorbidities, no question about that.
Sorry, Chief, and just real quick, sorry, but
That's all right.
can you talk again to the community who said that they're trying to find basic information? Where does this person live? Where did they travel? Basic
Sure.
information about when they traveled. I want to know if he was at the airport. When I was at the airport, people would want to know that. And
Sure.
you don't have that information, you say, so what's your message to people who say, what's going on?
Well, the message is that the information is there. We don't particularly have that here in the fire department of the city of Frisco in emergency management, but the health department does. And the city and the citizens can rest assured that all of those contacts will be made, that they will do a map and a map of where this patient has been, the contacts, all of those things will be looked at and crosswalked, and that's what epidemiologists do. People with degrees in public health, epidemiologists, they do surveillance tracking, and that's their job. That's what they do as a profession, and they'll run all of those contacts through and make sure that if anyone was a contact of this patient, that they will certainly notify them and do whatever they feel is next, whether it's additional testing or whether it's just evaluation. That will happen.
Are there just 2 tests that are done on people with these symptoms? So he's already tested once, or he's presented positive, and then they tested again?
Yeah, I can't speak to the presumptive test, and I'm not even know if that was a test or whether it was just a culmination of factors. We normally deal with the health department and the local hospitals with just one test, not two. I think that's another thing that probably should be emphasized is that we're not just the health departments we're in close contact with, but also our local hospitals. So we have regular meetings with all the local hospitals here in Frisco, outside of this area, because we transport patients outside of Frisco too. So we have an extremely close relationship with all the healthcare providers and facilities here in the Metroplex and in North Texas.
The presumptive positive, does that change anything as far as policies for cleaning and sanitizing municipal buildings and moving around town?
Well, not for us, because we've been doing that. We have, with our administrative services, have been looking at all the city facilities for several weeks. Our janitorial services are doing additional cleaning of what we consider public contact surfaces. It could be countertops, it could be other areas, obviously restrooms and facilities like that. So we've added additional cleaning. We have additional cleaning products that are really robust when it deals with infectious diseases we've been using. So again, this is something we've been doing for several weeks. So we're business as usual today. Our Emergency Operations Center is still at a level 4. That's our lowest activation level. That remains at level 4, and we don't see it increasing unless the situation here would increase. But right now, we are still at level 4 activation here in our EOC.
With the school district closed this week, has that affected communications with them, coordinations with them?
Absolutely not. We're in close contact with FISD every day. Our emergency management staff is also in contact with their emergency manager. We're on their conference calls as well that they have. So we're in very close contact with the school district. No, unless you have any other questions, I think that's all we have.
I want to just emphasize what people should do just basic.
Okay, great point. Yeah, and I think, sometimes we look at viruses like this and look at the complex. It's really the simple. And I think you've been hearing this message from the very beginning. Wash your hands. Keep your hands clean. Keep your hands away from your face. There's times when social distancing is appropriate, 6 feet. And I think that's something that we tell our responders. We look at all of our patients, that our dispatchers are screening all the calls that come in to our emergency communications center. They get screened. Our paramedics screen medical emergencies. We look at time distance shielding, again, the time it takes to interact with the patient, the distance, and also our personal protective equipment, which is our shielding. But again, common sense. It's washing your hands, keeping your hands clean, looking at some social distancing. And I think, when we do those and adhere to those rules that the CDC has been putting out for weeks and weeks and weeks, I think you really maximize, any potential that you would have, or I should say you should minimize that potential for exposure. Yes.
It sounds
Wait,
like,
oh,
I'm sorry, I couldn't see.
yes.
You said the health department is overseeing his isolation. Can you describe at all what that entails?
I'm sorry, I didn't hear your question.
The health department overseeing his isolation?
Yes.
Can you describe what that entails?
Yeah, so the health department will stay in close contact with the patient. There will be set times during the day that they will monitor the patient's vital signs and conditions. And in particular, and there's people that are under monitoring that are done that on a regular basis. Someone that if this patient does get a positive test, and they need to emphasize we don't know that yet, then I think the screening will be probably ramped up a little bit, and they will keep really close contact with this patient to see how they're doing. Normally, again, the symptoms are mild, they subside. It's only patients that we see that have cardiac issues, difficulty breathing, or things of that nature. And usually they're elderly, like I say, and they already have other existing diseases. They have comorbidities already, but usually in someone of this age, we would certainly expect, unless there's any underlying health conditions, that that person would make a full recovery.
The question I have.
Yes.
Is, if this disease begins to spread throughout the community and someone doesn't follow your suggestion and call their doctor,
Right.
and you transport someone
Yes.
who then later test positive for COVID-19,
Yes.
how confident are you that those first responders are both safe in transporting that person and they don't spread it to someone else
Right.
on perhaps their next call?
Right. So what we do is anybody that has any flu-like symptoms, any medical emergency, we have a little bit of a different scenario how we deal with that patient. Again, we limit the number of paramedics that are in direct contact with that patient. We have all the personal protective equipment. If you look at the CDC's evaluation, if you're a first responder and you have all of your PPE on and you are dealing with a positive coronavirus patient, once you deal with that patient and doff your personal protective equipment, you are considered a very low risk, if no risk at all. So we're confident that when we put on our protective equipment, we deal with the patient, we come back, we decontaminate our crew, they take their clothes off, and they put some new clothes on, and we have ways to decontaminate our medic units. There is absolutely little or no risk there to any other patients that we would see that day. In fact, in that scenario, those paramedics would stay at work.
Is this one man the only person who's quarantined at this point here?
There are other patients that are probably being monitored by the health department but are not quarantined. I would think this would be the first one that we know that absolutely has been asked to stay in your home for the 14-day period.
There are other people that are being watched.
I'm certain that there are some in the community that are probably being self-monitored, not monitored by the health department, but someone that would call their doctor and say, hey, I don't feel good, I have the flu, and I think their physician would say, okay, stay in your home for 14 days, and unless it subsides or you get worse, let us know. I mean, I think there's people that isolate because of the flu, and I'm sure that we have people that do that just because they want to make sure that their symptoms subside and that they're okay.